Okay, welcome to the Psych Commute. I am Dr. Brandon Brown in the Houston area, inpatient psychiatrist. And today I'm going to talk about focused ultrasound for psychiatric purposes. Focused ultrasound is not an established treatment modality in psychiatry at this point, but it is very likely to become an established treatment option at some point in the next several years. This technology is being used actively in small clinical trials now and recently. So what is focused ultrasound? So unlike diagnostic ultrasound, where you shoot out ultrasonic sound waves at a tissue and you image the reflection to be able to build up an image of some internal structures, focused ultrasound is meant to guide ultrasound waves to a focal point with the aim of either modulating the tissue at that focal point or lesioning it, destroying the tissue through heat. So there's two forms of focused ultrasound that we'll talk about, two categories, I should say. One category is low intensity focused ultrasound, or LIGHTFU, and the other is high intensity focused ultrasound, or HIFU. And I don't know if there is a strong consensus about some cutoff for LIGHTFU or HIFU, but one of the articles I read recently gave a power of 100 watts as sort of the boundary between LIGHTFU and HIFU. But really, the distinction is what you're trying to do to the tissue. But really, the distinction is what you're trying to do to the tissue. In LIGHTFU, by definition, it is not going to be a high enough energy to cause permanent damage. And with HIFU, definitionally, the intention is to cause permanent damage, to lesion, to ablate, to destroy the tissue at the focal point. So LIGHTFU is what I'm most excited about because theoretically, it offers the potential of just a much better version of TMS in a sense. TMS is great, but it has an inherent depth versus focality trade-off, just the physics of it. So if you want to penetrate deeper into the brain, you inherently must stimulate much bigger volumes of tissue. And so you trade off the focality, and probably the neural circuits that we are wanting to target. If we want to be specific, then we need focality. We need to be able to target small areas of the brain. So with TMS, you can really only target small areas of the superficial cortex if you're trying to be very focal. The good thing about TMS is that other than a very small chance of causing seizure, it's very safe. And you can both overall enhance or suppress neural activity depending on the parameters that you're using. So LIGHTFU has the potential to address some of the shortcomings of TMS because it can penetrate deep into the brain and it can target with millimeter resolution. So like cubic millimeter level of focality of tissue volume. Now, low intensity focused ultrasound can modulate the activity of neurons, and it is presently unclear exactly how that happens. From what I can tell, it seems that depending on the parameters of the ultrasound, so there's a large parameter space with focused ultrasound. You can control the overall energy that you're delivering. That's the power. You can control the frequency of the ultrasound waves. You can control if you're giving the ultrasound waves in brief pulses, how frequent those are. So there's a wide parameter space. And from what I can tell, there does seem to be a way to both enhance and suppress neural activity with focused ultrasound, depending on the parameters that you're using. However, overall, it seems that focused ultrasound is most often suppressing neural activity. And again, nobody knows exactly how this works because sound waves, whether ultrasound or not, are just mechanical pressure waves. And so how does a mechanical pressure wave stimulate or inhibit neurons is unclear. There's some evidence, I believe in vitro studies have shown that there are mechanosensitive potassium channels at the nodes of Ranvier along the axons of neurons. And so by stimulating those mechanosensitive potassium channels, that suppresses the neural activity, I suppose, by hyperpolarizing the axon, but it's not known for sure. So if it turns out to be that LIFU can only reliably suppress neural activity, that may be less useful than TMS in some situations. So I think at this point, it's unlikely that focused ultrasound will supplant TMS as a technology. They'll probably be used side by side depending on the condition being treated. Now, another interesting thing, if you're a nerd like me, is that if you do focused ultrasound in the presence of a strong magnetic field, like what happens in an MRI suite, you actually can directly electrically modulate the nerve cells. And this is caused by something called a Lorentz force. And there's a cool math equation. It says the Lorentz force on a charged particle is equal to the charge of the particle. So for example, +1 or -1 times, in parentheses, the electric field strength plus the velocity of the charged particle times the magnetic field that is present, in parentheses. So the force on the charged particle will be 0 if the particle has no charge, like a neutron, or if it's not moving, meaning the velocity is 0, or if the magnetic field is 0. So if there is a magnetic field, and then you cause the charged particles, we're talking about ions in a neuron, if you cause them to physically move with the ultrasound, again, these are mechanical pressure waves, in the presence of a magnetic field, they will start to feel this Lorentz force, and that will actually cause the charged particles to separate depending on their charge. So the negative ions will move in one direction, and the positive ions will move in the other direction. And that charge separation is essentially an electric current. And so that is how you get an electrical modulation of the nerve activity. So that is a different effect than just the effects on the putative mechanosensitive potassium channels. The other thing that focused ultrasound can be used for is enhancing drug delivery. So, and this is LIFU specifically. So if you focus the ultrasound at some of the blood vessels in the brain that compose the blood-brain barrier, you can sort of agitate them enough to open up the blood-brain barrier to where molecules that typically don't get into the central nervous system because of the blood-brain barrier or don't readily do so will more easily get in there. So this has been used already to deliver chemotherapeutic agents that aren't typically able to cross the blood-brain barrier for cases of brain cancer. But this has also been studied to deliver ketamine. And by combining this with a drug that is sort of dissolved in these microbubbles, you can have these caged molecules that are caged inside these microspheres or microbubbles, open up the blood-brain barrier, let them into the brain, and then sonicate the part of the brain where you want the drug to be delivered. And then that'll uncage and release the molecules just in that part of the brain. So that's pretty cool. Now, high intensity focused ultrasound is actually in clinical practice. LIFU is only right now used, as far as I recall, for the delivery of chemotherapy in the brain to open the blood-brain barrier, as I just described. HIFU is also clinically used to lesion the brain. So I believe it's in routine clinical practice for treating tremors. I can't remember if it's a central tremor or Parkinsonian tremors or both, but it's some kind of thalamus lesion. I don't remember which specific part of the thalamus, but lesioning that, and you get a reduction in the tremors. And then in terms of research trials, there's been research trials, small open label studies on lesioning the anterior limb of the internal capsule for OCD, and I think also for MDD, if I recall correctly. Now, because the skull is not very conductive for ultrasound, some patients, due to their skull anatomy, are unable to get focused ultrasound to the place that we needed to get to. So they said about, from the article I read, about 20% of people just have a skull anatomy where you really can't get very deep into the brain with the current technology. So LIFU, we've got LIFU used for neuromodulation and drug delivery. We've got HIFU for lesioning. Both of these have potential applications in psychiatry. I should say, one other thing I'm just remembering with HIFU is that you're lesioning by heating up a part of the brain beyond 52 degrees Celsius. And the cool thing is you can actually do this in a real-time MRI scanner. And so there's something called MRI thermometry. And so you can actually see the temperature at different parts of the brain. And so the surgeons will very carefully increase the ultrasound energy and monitor the temperature changes in real time to be able to do that safely. So, all right. Well, I am definitely excited about focused ultrasound for psychiatry. And obviously, there's a lot of research still that needs to be done, but keep an eye out for it. Take care.